And so I would like to welcome Dr. Behdin Nowrouzi-Kia. He is an occupational therapist and assistant professor in the Department of Occupational Science and Occupational Therapy. He holds the inaugural Emily Geldseller Grant Early Career Professorship in Workplace Mental Health. He is an affiliate scientist at the Kremble Research Institute, Toronto Western Hospital, University Health Network, a collaborating scientist at the Center for Addiction and Mental Health, and a cross-faculty researcher. So let's welcome Dr. Nowrouzi-Kia, building diverse, equitable, and inclusive organizational culture to support worker mental health and well-being, a qualitative study of employer and worker perspectives in Ontario construction skilled trades.
Okay, great. Thank you very much for that kind introduction. And looking at the program, it looks like it's a very interesting CrossCon 2026. Never disappoints. So I want to tell you a little bit about some of the work that my lab is doing at the University of Toronto across Ontario, which also includes Northern Ontario. So for the next 20 minutes or so, I'll tell you a little bit about my team, our story, and also some of the work that we're doing. So my learning objectives for you for this session are one, to tell you more about the partnership that exists between the Ontario Electrical League and who they are, and the Restore Lab, and I'll tell you more about them as well at the University of Toronto. Equally, I'll tell you more about the diversity, equity, and inclusion perspective and lens that we take in the skilled trades and why that's important. And then finally, I'll tell you and I'll identify some of the important attributes and perspectives that both employers and workers in the electrical and plumbing sector in Ontario have identified to us and what that means for us moving forward, particularly when we're looking at workplace mental health and occupational health and safety in general. So a little bit about where I'm situated. So I'm a very proud LU, Laurentian University grad, and since then I've moved on to have an opportunity to start my own lab at another institution, and that lab is the Rehabilitation Sciences through Occupational Research and Engagement. And our mission is to identify and assess risk and develop occupation-based interventions to prevent high-risk behaviors, optimize workplace functioning, and improve mental and physical health. So that's really what we're about. If you're interested, and my understanding is that there's lots of learners here today. So if you're interested in learning more about our work, connecting with us, if there's an opportunity for us to engage, I'd be happy to have that conversation with you. One of the areas that I'm quite proud of is that, we live in a very diverse country, particularly where I'm situated at the University of Toronto. Half of our population is born outside the country. So naturally, the communities that we serve should be a reflection of those individuals as well. So we have an equity diversity statement on our lab website, and we're very proud of that. We also have a publication list where you can see the latest and greatest that our team is working on, and that team includes undergraduate trainees, graduate trainees, postdoctoral fellows, and collaborating scientists as well across Ontario and Canada. And we also have an online network. So if you want to see where some of our previous trainees have gone on to, whether they've gone on to professional programs like occupational therapy, medicine, nursing, etc., or some of them have gone into research disciplines doing master's and PhD work, I invite you to take a look at our website. I also put my contact information here in case you want to get a hold of me, lots of different ways. I don't think too many people give me calls, but happy to entertain those as well as email. There's a QR code on our website and some of the linkages that I have. So I'll tell you a little bit about the Ontario Electrical League. They're a nonprofit charitable organization, and they have chapters across Ontario and some in Northern Ontario too, where Crosh is. And as a result of that, they represent non-unionized employers. So those are employers that are largely having small businesses, and they employ electricians and other construction trades professionals. And as a result of that, They want to ensure that equity, diversity, and inclusion is properly represented in their workforce as well. And one of the challenges, particularly in the construction sector, has been is examining workplace mental health. So as a nonprofit, they're membership driven and they've been around for over 100 years. They're particularly interested in kind of exploring these types of topics because in the construction sector and the electrical sector, these are relatively underexplored. And until very recently, there hasn't been a lot of interest. And there's lots of factors for that and more. And, we've been working with the Ontario Electrical League for several years. Actually, it's going to be close to 5 years now. And we've looked at a variety of activities, including addressing retention and recruitment in this sector, developing practical toolkits for mental health, equity, diversity, inclusion, looking at how we can provide resources to small and medium-sized businesses support their workforce when it comes to physical and mental health. Today, I'll talk to you a little bit about the DEI aspect of it or the EDI aspect and some of the work that a former postdoctoral fellow of mine did. So just high level, we've recruited nearly 500 participants since we've started working with the Ontario Electrical League and their members, and we're quite proud of the work that we've done. We've done qualitative work, we've done quantitative work, we've done work in the field. So one of my doctoral students now is collecting data in workplaces themselves. So naturally, she has a clinical background as an occupational therapist, so she's particularly interested in functioning and movement and aligning that to optimizing performance in work. So that's kind of some of the work that we're doing. But we've also done other types of projects as well, where we've kind of looked at the gene environment interactions, where a former postdoctoral fellow of mine had expertise in that. And we married that with some of the self-reported data on the qualitative questionnaires and the quantitative questionnaires around burnout, job stress, and looked at some of those outcomes as well. If you're interested in that, I invite you to take a look at our website for those publications. But today I get the great pleasure of telling you about a paper of ours that was just recently published in Safety and Health at Work. And that's the title of my presentation, where our team explored in particular the construction sector and the electrical sector more so by interviewing over 50 participants, specifically 52 participants. And really what we did was we wanted to kind of explore what DEI meant, what DEI looked like when it came to mental health and well-being. Because some of the challenges in this sector, and maybe some of you already know, is that it is relatively masculinized. There's more men than women in the trade. It's been fairly resistant to integration and inclusion of other perspectives. That's the evidence from the literature. So experiences and research substantiates people having experiences of sexism, age discrimination, gender discrimination. So this is a challenge that we've been working on with them for quite some time. And one of the projects that we looked at was looking at this through a DEI lens. And this paper gets into that. So what did we do in this paper? We really were soliciting the perspectives of employers and workers in the skilled trades. And we also wanted to identify strategies. So we didn't want to leave them empty-handed in the sense that they didn't know what to do now that we've identified the problems. We wanted to also be solution focused. So how do we build that into the environment? So what do we do exactly? We use a phenomenological design where we want to explore lived experience of individuals and their employers. And this project was led by my postdoctoral fellow at the time. And he did some semi-structured interviews that were approximately 45 minutes to 60 minutes in length. And you can see the age range. So we talked to workers that were apprentices in the skilled trades, all the way up to folks that had their businesses for quite some time. And it represented a broad landscape of small and medium-sized enterprises in Ontario. And then we did some qualitative analysis using Braun and Clark's six-step inductive thematic analysis. We looked at intersectionality and diversity and inclusion frameworks, particularly Crenshaw's work that looked at intersectionality being, sitting at the cross sections of someone's personal identity, their ethnicity, their employment, their education, and we looked at an intersectional lens as well. And then we did some qualitative analysis. We reviewed our transcripts. We coded them independently, came back as a collective, We reviewed our transcripts and worked with some of our partners at the Ontario Electrical League to ensure that they represented what we captured what we intended to, and then we organized codes. So this is just some of the descriptive sample that we reported on. So you can kind of see the mix of employers and workers. Approximately not surprisingly, there were more men than women. We had 48 men in total. 34 of them were workers and 14 were employers. And we had less women as employers as well. We didn't report those just because the sample size are quite small. But yes, and then you can see the breakdown, predominantly white European North American, and less in the other categories as well. And that sample was recruited through the Ontario Electrical League's network and chapters across Ontario. So we tried to be very deliberate in getting representation from large urban centers, smaller rural areas in Southern Ontario and Northern Ontario. But obviously, at the end of the day, it's voluntary. So whoever wished to participate could. And then we looked at the data. So what else did we find in terms of the qualitative reports? What we found were the following three key themes. One was the challenges in organizational culture. So specifically, participants reported sexism and biased beliefs on professional competency of workers from underrepresented groups were quite prevalent in the organizations they worked in. Uh, Participants also highlighted business leadership role in building DEI or EDI culture and how important it was to have both a bottom-up and top-down approach. And this affected the organization's reputation and also worker retention. So people were more likely to stay in workplaces that adhered to that diversity, adhered to that equity and inclusion. And it actually kept workers staying in a particular workplace. Another theme that we identified were barriers to promoting DEI. So naturally, we were interested in looking at this from a perspective of how do we identify what the issues are. And we identified and restricted specific opportunities that were out of reach for underrepresented groups. So these were not just based on ethnicity, but we also looked at newcomers, for example, indigenous populations, anybody that wanted to get into the skilled trades. And like so many other areas of our labor force, including healthcare and education, we have a severe shortage. And these workers are critical to building our critical infrastructure, our schools, our roads, our hospitals, but we don't have enough of them. And many of them are close to retirement. So these are pertinent issues and why, particularly at the provincial and national level, there's a lot of interest in this work. So in addition to identifying barriers and the lack of accommodations, we also looked at strategies. So what could we do in particular? And what we found out was that strategies to promote, pardon me, EDI or DEI, our participants suggested that there should be more early career opportunities, particularly for apprentices and those in underrepresented groups. They also mentioned that employers um, need to be part of the discussion and they need to help, particularly from the perspective of the employers, to recognize that these opportunities that are provided to workers and workplaces need to recognize and incorporate the variety of diverse perspectives that the workplace has. And then also establishing resources and peer support systems to particularly to support mental health, because that's an area that in some of the other work that we've done, and this bleeds into this, is that, we've heard that there is no mental health concern, although the skilled trades in particular and the construction sector report higher than national averages across a variety of mental health outcomes, including suicide, depression, and so forth. So these are issues that we're just scratching the surface on. And in some of the work that we've done as well, we've addressed this by developing specific toolkits as well following this work. I've talked a little bit about this, but just to summarize it for you, in theme one, we talked about sexism, bias beliefs, and leadership concerns, and how important it is to have that bottom-up and top-down approach. In theme two, the lack of accommodations, the lack of awareness, and the meritocratic hiring approach. So meaning that, there should be a much more broader perspective. There should be a much more equitable perspective to including workers. And as human beings, we naturally gravitate to our networks and those that we know, but you could be missing out on a significant talent pool that could, augment your workplace and enhance worker productivity. Finally, in theme three, we looked at creating early opportunity, resources, and peer support. How all of these are integral to supporting DEI, particularly when it comes to mental health in the workplace, in the construction sector. So what's next for us? In terms of the discussion, I would say that despite our very best efforts to try to recruit across a variety of lived experiences, we still got a predominantly homogeneous sample of ethnicity and diversity. So we didn't get, for example, too many women. We didn't get too many individuals that were newcomers to Canada, Indigenous workers, and we didn't get too much representation from northern, rural, or remote regions. The interviews were done remotely. And despite that, and many times allowing participants to give us their schedule and working on their schedule, we still had difficulties getting that diverse range of perspectives. I don't think that's anything new to anybody, but just to recognize that we did try, and we're going to continue to try, and we are in some of the other work that we're doing, and we have some strategies to address some of that. But that was one of the limitations of our study. And then naturally, given that we did a lot of these interviews online and we used our networks through the Ontario Electrical League, there might be perceived biases that someone might think this could impact their employment. How would this affect if I share this type of personal information, despite the fact that confidentiality and anonymity were assured? Naturally, coming to this as a university center, we came into this to study this from an academic perspective, a scientific perspective. So we did assure that, but it was still probably a challenge because mental health has stigma attached to it as well. And then finally, I think as we move forward and as our team and our lab continues to work in the skilled trades and the construction sector across Ontario, we have to recognize that there are deep issues that are not only at the individual level, but also systemic, meaning that workplaces and the culture itself has to be studied much more carefully. And we have to look at approaches to ameliorate workplace mental health. I think another aspect that has to be also looked at, and it's not just to the skilled trades or construction sector, is that accommodations and awareness around how best to support workers is still relatively deficient, particularly when it comes to workplace mental health. So that's a challenge and also an opportunity too. And naturally, career opportunities in this space have to be bolstered, particularly for those that are interested in this area. Many will enter it after high school, although the apprentice age has been increasing. So some people are starting to become an apprentice in their late 20s, 30s, and even in their 40s. And then now what we're trying to do and study in the future is looking at potentially those that go through this system, and there's a training period, 5 years until you become a journey person. How do we support them, for example, if there's a setback, if there's potentially, a failure in the classroom with the course content, or a challenge with one of their apprenticeships? And we're looking at that exactly now. So those that don't make it, how do we support them so that we can get them to the finish line? Kind of, again, speaks to our accommodations piece. And then finally, this idea of building a DEI or EDI culture isn't something that happens overnight. It also isn't something that, one or two studies will address. I think you have to look at it from a much more broader perspective. I think the landscape internationally has changed in lots of places geopolitically. And as a result, EDI or DEI may not be as much in fashion, but it's very much needed. And the research continues to substantiate. And in this particular sector, it's important for recruitment, career satisfaction, for civil discourse, respect, and lots of other outcomes. And naturally, it's good for their health that I didn't mention that. as a healthcare provider, that's also very important to me to make sure that people are healthy in the workplace. So, in conclusion, I think that we have still a lot of work to do. We're interested in this area, and I'm looking forward to, expanding our understanding, particularly in the skilled trades. And as Canada federally builds the, more interest and more focus, for example, in the construction sector with building more housing and other types of infrastructure projects, the need for these types of research and evidence is even further noticed and appreciated. That's it. Thank you so much for your attention.
Awesome. Thank you. So you can put any questions in the Q&A. I have a couple. So what are your strategies for increasing participation? You mentioned
Yeah,
there are some.
sure. That's a good question. So, from my perspective, I think what we have to do is, and what we're doing now is that we're continuing to be much more proactive, going to local chapter meetings, creating workshops and opportunities and aligning our research activities with what the Ontario Electrical League is doing um, in their workshops, in their spaces. So we're there to kind of promote the research, tell them about what we're doing as a whole, not just anytime we need participants for research, but rather when we're available to help them out. So if they have these road shows that they do in September where they go across Ontario. We're there to kind of talk about our research and some of the findings that we have and engage with people and tell them that this research is making a difference in a practical manner as well.
Awesome. So you had mentioned that some of the recruitment, so obviously we have very similar. So when we're recruiting in trades or anything, um, trades, mining, construction, forestry, any of the things, one of the limitations is it that we you're doing the online virtual, what were there opportunities for them to actually do in-person work or in-person interviews and things like that without having to be online?
Yes, there were. Most, believe it or not, didn't want to do it in person because they were working and it was much more convenient for them to do it online. So we were amenable to their schedule. So many of them worked between 12 to 14-hour days, and they prefer to do the schedule to do the interviews online, either very late in the evening or on the weekend or between lunch break or things like that where they can pop on their device and talk to us in that way. So their preference was actually to do it online. But there were a few that wanted to do it in person, but the challenge with in person then became, finding a place that was convenient for them. So very few did, but most preferred online.
Okay.